Hi, everyone. Welcome to the Marvix AI Podcast series, where we are having conversations at the intersection of healthcare and AI. Through this series, we are going to have conversations with healthcare leaders, clinical operators, administrators, and innovators. Now, AI has entered healthcare rapidly over the last few years, but healthcare is operationally messy, it's regulated, it's human, and some interventions have been thoughtful, but some interventions by AI have been chaotic. And through this series, we are asking this central question: how is AI shaping healthcare experiences? And with this, let's get started with our first episode. And I'm very, very happy to introduce my first guest, Amanda McFayden. Amanda is the Director of Clinical Operations at the Dent Neurologic Institute. Dent is one of the largest outpatient neuroscience centers in the country. Operational clinical operations sits at the heartbeat of hospital operations, and I'm really very interested in exploring Amanda's point of view in how AI is reshaping healthcare experiences in health in their organization and elsewhere. Amanda, welcome to the podcast. So nice to have you.
Thanks for
So
having.
before we get started, Amanda, I would love for you to share a little bit about your background, how your career journey has been, and what led you to where you are today.
Um, yeah, thank you for having me today. And I've been at Dent for just shy of 20 years, and so I started actually when I was a senior in high school at Dent. So it's largely, my family at this point. I've been here for so many years. And if you had told me back then that I was going to be in healthcare, I would have, it would have taken me back by surprise. And I think I started working here in medical records, and I've done a lot of our, entry level positions, and I think that that's what gives me a lot of value in my role now of just knowing how our teams function and really having a true like a love for those people and the value that they bring to our company. um but I think when I first got to start working with our PAs and NPs years ago as like a 18-year-old, I didn't even realize that that was like a pathway you could do in a career. And I was like, man, I really wish I had had that opportunity. Like, I went to a kind of more rural high school. We didn't really have someone that was guiding us in that way. And but I loved doing the efficiency work. So I was like, you know what? I actually don't want to be a provider. I want to do things that help our providers help people. And so that's kind of how I ended up in my role long term. But I think it was by working kind of up to that position. And so I love what I do because I get to help people, so that's why I enjoy my role.
And remind me how many years you've been with Dent now?
It'll be 20 years in May.
Oh
So
my God. Wow,
yeah,
that's amazing.
a lot of years.
That's
Yeah.
insane.
Yeah.
Yeah. That's great. And for context, we've worked with Dent very closely in adoption of Marvix AI within their organization over the last 12 months. And sort of that segues into my next question for you, Amanda. You've obviously seen very large clinical and operational teams. You've seen some of these adoptions over months. And what problems or pressure points, especially in the context of AI in neurology, you think exist today that make this adoption of AI move from interesting to necessary for organizations such as Dent?
Sure. I think AI, the discussion of AI in our organization in particular, really exactly like you said, became more of a necessity than like, is this interesting? Is this something that we should be dabbling in? It really became we need to integrate AI solutions between a mixture of support staff and provider level care because of burnout. So after COVID, staffing changed tremendously. So I think on a staffing side of things, we really were looking at AI solutions for processes such as authorization and things like that. And then on the provider side, healthcare has just really become so burdensome as far as all of the little nuances that the providers have to focus on, like documentation, very specific blurbs on, how to get certain things approved from the insurance side of things, and imaging requiring peer-to-peers and all of that stuff, that it's really making the job for them impossible to remember all of those little things in their clinical notes. So at the end of the day, we're all human, as you mentioned, and it's hard. It's really hard. So we tried our best before AI was around to do things in our EMR, like little triggers, little, things that would pop up and try and remind them and hold their hand as much as possible. But between all of the labs and the medications and the um, other things that they have to do besides just seeing patients in the day, we really wanted to find something that would help take away some of that brain fatigue give them back a lunch break, get them home sooner. And that was honestly our biggest motivation for implementing an AI solution. So between that and then also hopefully downstream having some positive impact on getting insurance authorizations better because the documentation is better. So that was like selfishly, we had some other, motivations there too, but our number one motivation was reducing provider burnout. And that's why we started looking at AI solutions for Scribe.
Yeah, I mean, over the last few decades, I feel that one of the most pertinent problems in healthcare has been provider burnout that needs solving. And it's just insane how much administrative burden providers are drowned in over and above the clinical responsibilities they have. And so I feel like last 3 years were probably a pivotal point in healthcare in many ways where AI came in and there was at least an opportunity for providers to explore avenues or processes that could automate a lot of these workflows. But I'm assuming that brings its own set of challenges because now you have this very important decision to make on how to choose an AI solution that A, obviously addresses pain points that are unique to your organization, but B, also integrates nicely with your workflows because you're not really working with just one software system. I'm assuming there are many different moving parts to it, and people are obviously used to certain processes. And so I'm assuming that you must have done a lot of prep work, maybe created checklists of
Mhm.
must-haves and good-to-haves. And if there is any organization or administrators out there who are looking to even approach this sort of very overwhelming problem of getting AI adopted in the organization, how should they go about creating this criteria for AI vendors?
Great question. So I would call it a luxury. I'm in outpatient neurology. And so I'm not kind of beholden to the hospital like healthcare system. So I take that with a grain of salt as I'm talking through that. But we did a lot of structural like thought through what is it that we're going to implement? What are these companies that we're going to work through? And we looked at dozens. We had, criteria of like the must-haves, as you mentioned, and our must-haves really were customization of, it's not a one-size-fits-all for each of our providers because everyone has their own flair for documentation. Um, in neurology, obviously, we see A through Z of every, subspecialty in between. So as such, all notes are going to look a little different, right? And then the EMR system is another one. So we use an EMR system that we just wanted to make sure that the technology was agnostic and could integrate with that tool. And that was really important for us to be able to pull old progress notes and to be able to have it right back in an effort to make everything as efficient as possible. So those were two of our like must-haves. And we piloted companies for at least a good year before we partnered with Marvix. And the one company that we used in a pilot phase, we used the same providers that we piloted with Marvix for the tool, and it was helpful to have them see the first round of what that could look like for them compared to what it looked like with a Marvix solution. And the other tool was just really not customizable. So this is what the template is. It didn't look like our EMR templates. It made them feel like they weren't comfortable, and I think that really defeated the point of like we were trying to reduce burnout. We weren't trying to make this a heavy lift. We were trying to make this as easy as possible for providers and to make them feel like this tool was going to be benefiting them, not kind of working against them. And ultimately, that's what made us not continue on with that pilot and look for other tools. And that's where we landed on Marvix.
No,
So,
that's, I have to say, from our experience working with you guys, what really I guess, surprised us was how prepared you were in the evaluation process. You had a checklist. You knew what you wanted. And from the perspective of an AI vendor that's trying to work with a larger organization, that makes a lot of difference because I think if the organization can also articulate the problems that they're looking to solve for, it just makes it really easy to find a solution, find a path forward that's just optimized for them. And many times I see these adoptions taking so long, these rollouts taking so long, and it's really not really a fault of the vendors or the other organizations or the healthcare systems. It's just that things are not articulated, the checklists aren't in place, and you sort of discover as you go. So I thought that was one of the best experiences we had as a vendor working with you guys.
yeah, I
Uh,
would. have a strategic development team. So whatever that looks like for, anyone that's listening, anyone's team out there, like it is important to have the stakeholders on board of just like, what does this look like for your company? What are your needs and what are your goals? To kind of formulate that checklist. And I think we're really fortunate. We have a very like forward-thinking CEO here. And so she, sat us down and we talk about AI all the time. So I think that that has a lot to do with our success in that because she's just, again, like very forward-thinking and we're always looking for like the next best. And I know that not every company has, again, like that luxury. So we're very fortunate in that regard. But I would definitely agree. A checklist is really helpful.
Yeah, absolutely. Um, I guess the other question that a lot of people have is, okay, once you finalized an AI vendor you want to work with and you've given a sign off, are things rosy after that? Or is there a lot of protocol processes involved internally as a center, as a healthcare provider? Are you guys internally creating roadmaps for rollouts? On a day-to-day basis, how taxing is it for administrators and clinical operations team to manage these rollouts?
I think being aware that in the beginning it's going to be a heavier lift, right? I think we've been working with you for actually just shy of a year now. And it's now in like the latter part of this year, it's very much so like rolling on its own. I'm managing the process. I'm checking in on our providers, but I think initially up front, the biggest advice I could give is like having provider champions. I think my success with the rollout is that I have provider relationships, and I know my providers well, or I like to think I do, and I know what they're looking for, so I can help articulate that to Marvix as our vendor. But as far as like, no one knows better than a provider peer what this is going to be impacting them. So our biggest success at the very beginning of working with you guys was having the piloting phase, like I said, and we had about 7 or 8 provider champions. And I used a variation of I had a couple physicians, I had a couple nurse practitioners, a couple physician assistants, and they all were from different subspecialties. They all charted differently, and that really helped us be able to determine like, is it going to pick up different dialects? Is it going to pick up a fast talker versus a slow talker? Is it going to, how is this going to work and how is this impacting across the entire organization? Because if I pick one siloed, clinic and it works well there, I can't get the buy-in of my entire organization, right? So having that peer buy-in was really helpful for they're seeing their next door neighbor using this tool and now they're like, I want to use this tool. They're seeing that um, you know, Jane is going to get her lunch today, and maybe I'm working through my lunch because I'm using a less effective tool. And so that's kind of where it started as far as like, how are we the heavier lift, right? It was like the pilot, and then it moved into implementation and rollout. And so after the pilot, we started having the discussions of like, what are the checklist items of checking in on the providers and making sure that they've done all their proper training and all that stuff. So I have my own checklist, you guys have your own checklist, and we do often, compare those. And I just want to make sure that my providers are doing everything that they need to do. They're using the tool efficiently. So it's not that you have to do it that way. It's just what we found that works best is making sure that providers are always up to date on what the tool, all the features are, that they're using it as efficiently as possible, that we're kind of comparing against their peers, like how is this person using it versus this person, because everyone does ultimately use it a little differently.
Yeah.
And I think that's what makes Marvix really cool is that they have that ability, that you can use it as bare bones as you want to, and it's still going to make you more efficient, or you could use it in the most robust capacity. But now a year later, like I mentioned, I'm really just checking in on my providers, making sure that they know, and we're kind of rolling smooth steam ahead, and it's working really well. But there is an initial lift for sure.
And the initial lift, I have to add, training, one-on-one provider training is so critical. And again, as a vendor, one oftentimes feels that, okay, this is something that we can absolutely do, but you need on-the-ground champions to ensure that the providers also go through that training. And one of the I guess best memories of working with you guys was my best memories of working with you guys was that we set up these trainings and that there was a feedback loop coming in from you. Hey, well, these two providers need their trainings, and
Mhm.
we want to train them again. And that was so helpful because it was almost like there was an on-the-ground champion who also wanted this pilot to be a success. And
Yeah.
I think so many times startups, I think this is true for most tech companies, but especially true for startups. They get into these pilots with larger groups, and these pilots are not successful. And part of the reason is just because adoption is lukewarm, and the training loop and closing the training loop is so critical, especially in those initial months with super users, and then of course the next batch of users. Of course, like you said, as the adoption increases, the last phase is probably easier because you have so many existing users. But that initial phase is so important to get right. And having on the ground champions with clinical operators such as yourself makes it so
Yeah.
easy to close that
And
loop.
I think thank you for bringing up the like the Zoom trainings and things like that because I kind of jumped over that. But something that you guys did really nicely, I think, is your flexibility with we did a few sessions, towards the beginning when we had a lot of providers that were very apprehensive on it because AI is a little scary, right? Some providers were very anxious to just jump in full steam ahead and had no apprehension. And then I had providers that were like, whoa, 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 I want nothing to do with this. I document perfectly fine. I'm already very efficient. And so we did, if you recall, we did like a really early before clinic Zoom training, more of like a demo, and we did an after clinic one. And I sent it out organization wide, and I said, anyone that's just on the fence that wants to know a little bit more about Marvix or like what we're doing in this pilot, why don't you hop on? And I probably had like 25 providers sign on after that demo just because they were like, oh, wow, like I feel a lot more comfortable. And it really just takes like 10 to 15 minutes to kind of get a vibe of what Marvix could do for them and to see that flexibility. So I think that's also a critical part of, as you're trying to implement this into your organization, like giving them little pockets and being around their like clinic day too. So like don't inconvenience them, give them areas of time where like they're able to hop in at their convenience before or after clinic. The Marvix team has really nice flexibility with like your Zoom trainings and stuff, so it works around their schedule. And then you guys do retrainings too. So if someone isn't, really sure and needs some refreshers, you guys are always really accessible. So that's been really helpful for us too.
Yeah, I think with software, healthcare software, there are just so many moving parts, and it's a tough customer to I guess impress because these are busy customers.
Yeah.
They have their patients, and probably learning a new piece of software is the last thing they want to do. So getting them interested, getting them finding time on their calendars and incentivized to do the training. There's so much heavy lifting required, and I think with good partners, you can see that turn around really nicely. So we had that experience with you guys. I also wanted to talk about sort of like a playbook here, right? Because I think, and again, as a startup, we end up creating playbooks on from pilot to I guess a customer. What are the 10 steps involved? What are the pain points that we have to make sure that we address? Is it a play? Did you ever create a playbook on your end, and not necessarily for the adoption of AI or adoption
Mhm.
software from a particular vendor? In general, when you're thinking about driving these technology-led innovation initiatives in your organization, bringing in new tools, do you, as a director of clinical operations in your organization, do you have a playbook that, okay, this is where I start, this is where I end? These are some of the aspects that absolutely need to be nailed even before we take on this project.
Yeah, I think it looks a little different, right, for every technology. And I think I mentioned we have a strategic development team. So as far as our structure goes of our playbooks, I mean, I think it's more of like conversational versus like actually, written down. But we do, we have a where we're starting, our why, why are we implementing this? And what are we going to be asking our providers of? So, let's separate the two. Like if this is a provider-led tool that we're doing, sometimes it's like a different conversation because it's more staff focused. But in this particular one, we looked at the cost of the tool. We had to do a lot of evaluation up front of like, what is the cost? What is the cost of integration if we're going to do that down the line? What are we going to be asking of our providers to cover the cost of this tool? What is our motivation for the tool? So in ours, our motivation was reducing burnout versus asking our providers to see 15 more patients a day and drive revenue. Like that really wasn't our goal. If it happened naturally, obviously that's fantastic. But we were really looking for something to benefit our providers in a positive way and help them to work at the top of their license, which is always our goal at Dent. And so we really started with that. It's like that conversation of like the whys, the hows, and then from there, we move into the pilot phase, we move into the provider champions, and we have that feedback, like you mentioned. So we have a lot of conversation of like, is this truly reducing your provider burnout? Are you able to hit these certain goals now? Like, are you able to take a lunch? Are you leaving your work at the door and able to go home earlier? And we did that with surveys. So when you ask about playbook, surveys were a huge part of making sure that this tool was being successfully implemented for us. And so we did check-ins with our providers, our piloting providers of, do you feel like these certain metrics are being hit? And we had 100% like, yes, 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 across the board. It's reducing my brain fatigue. I'm able to take a lunch. I'm able to go home with my family. And that was really important. The other part of our thing, we had, kind of like an attestation of like, you're acknowledging that you're asking for a Scribe AI. This is what we're asking of you. Do you agree to it? So we had the documentation on our end. And then just, following up and making sure that everyone's, like I said, using it, they're trained and everything. And then long term with as far as the playbook goes, is measuring those KPIs. And
Mhm.
it is a little hard with, this type of thing because like I said, we're trying more so to reduce a objective measure or,
Yeah.
subjective measure and making it objective, which is like, is your, brain fatigue, burnout, et cetera. And long term, we're going to see that benefit by, reduction in turnover and overall provider satisfaction and things like that. So they're not necessarily measurable KPIs,
Yeah.
in certain regards, but there will be long-term measurable KPIs. And I think that that's really what we were looking at in our playbook.
What I really like about the KPIs that you just listed is the fact that they're so much focused on the end user, the provider, as well as the patients in many cases. I see this often that in a lot of larger organizations, healthcare organizations, there's a misalignment almost between the goals that the management wants to pursue and
Mhm.
the goals that the providers have. There's a lot of focus, for example, on cost reduction. Just taking an
Mhm.
example, that may come
Mhm.
sometimes at the cost of not optimizing the experience for the providers. And I have to give a shout out to Dent in this regard because I think never before had I seen such close alignment between management goals and provider goals, and that really showed. And the fact that your KPIs are all about provider burnout reduction, improving patient outcomes, making sure that there's more, I guess, face time with the patients,
Mhm.
productivity increase for the providers. That speaks volumes about how you guys approach this. Yeah.
Yeah. Yeah, we're a physician-led organization, so I think we're always like, as far administratively, like we work for our physician leaders. So I think that really like actually warms me to like hear that you feel like we are aligned on that because I think we are very passionate about making sure we are aligned with their best interests. Um, but yeah, I think that it's really important. And I think what is nice about Marvix that allowed us to have that mindset was that you are a very cost-effective tool. And I think that without getting into specific pricing, obviously, when we looked at different tools and comparatively, it was night and day. And I really think that allows us to stay at like the really good-hearted goal, which is provider burnout versus like having to drive volumes through the roof just to cover the cost of a tool. Because the turnover cost alone, if you're avoiding like losing a APP to your team or getting scans covered that wouldn't otherwise be covered with that, like that alone covers the cost of the tool, in our opinion. So I really do think that whoever's listening, just challenging yourself to look at like what is the value of the tool for you as far as like when you're looking at a pro forma and you're
Mhm.
trying to find the financial benefit of the tool. It doesn't always have to be driving more volume because you're going to have a downstream effect financially positively from the tool.
Yeah, yeah, agree, completely agree. I wanted to switch gears and move to just getting your thoughts on AI. Obviously, there's a lot of noise. It looks like everybody wants to talk about AI in healthcare. Everybody has an opinion on AI in healthcare. You open any news article, of course, there's going to be mention of AI in some form of way. And to a layman, it appears that there's just an inundation of AI tools right now, and problems are just solved, and everybody's just spoiled for choices. And that might be true in most cases. But what I've learned working with some specialty groups, let's just say neurology groups such as yours, is that the workflows and the ground reality of these workflows in neurology, for example, care,
Mhm.
are very, very complex. The ground reality is extremely intricate, and AI is just about beginning to scratch the surface. Now, somebody
Mhm.
who's used AI over the last 12 months and obviously evaluated AI, I wanted to hear your thoughts on the promise of AI, but of course, also the
Mhm.
frictions, what has worked and what hasn't, and how far
Sure.
up from the ideal, I guess, place that we want to be in terms of being spoiled for choices, let's say.
Sure. I think when like I'll reference back to like the our previous pilot and if I'm comparing like the two tools, because as you mentioned, like neurology, it's complex. There's a lot of the language is complex, the words are complex, and the intonation of the provider is, it can be complex. So you want to make sure that you've got a tool that's is eloquently saying that back, and there's not a ton of grammatical errors or spelling errors or um, hallucinations or like finding things. So like those are like the words you'll start hearing when you're working with AI more. And I think the one of our complaints that we got a lot from our providers initially from the previous pilots were like, this note doesn't sound anything like me. I don't talk like that. This actually sounds like a high school level. Like I am embarrassed. I would be embarrassed to send this out to my colleague in the community. Like if I'm sending it back to a primary care provider, and if that's how the tool is going to work for you, like you're never going to get the provider buy-in on that. So no one's going to want to go from having these like really beautiful, eloquent notes that they're handcrafting to having something that doesn't sound anything like them.
Yeah.
So although with AI and like with Marvix, like there's naturally going to be spelling errors and things like that. Which is why I love like the proper names and all of these different things in the settings that Marvix has where you can say like, okay, the AI heard this, it's spelled this way, but it's really not. And as soon as you correct it, it corrects it forever for you, which is really nice. But that's just natural. If you use a transcriptionist or if you use a dragon microphone or anything like that, there's always going to be those learning curves with spelling and things. But I think overall we were really impressed with how it just sounded like a clinician out of the box. And like that was out of the box. So I think there's something I've learned about AI is like how customizable it is. Like you guys can do a product loop on the back end if we give feedback or um and I'm not sure it's like that for every tool. I can't really say. I think that's what impressed us about your company was our ability to customize it to the provider's needs. So if someone's saying like this is really it's too chatty, it's too quotey, it's you have the ability to increase or decrease the sensitivity. And so I think that that's what we've learned a lot with the AI is like the vendors that you want to pick are the ones that hear you and hear your feedback and aren't just like one size fits all and it's this is what you're getting out of the box because I don't think AI is one size fits all. I think that like everyone has their own um, they obviously have their own coding teams and different things, and the way you're pulling the AI is different. And you just want to make sure that it sounds the way that you want it to sound, and that it's saying it and not giving weird recommendations or hallucinating. So I think those are things that we've learned this year for sure.
I've also learned that it's a learning journey for any AI vendor. Like when you work with a specialty organization, every year, let's say every month, you learn from experiences, you understand the complexity of the workflows that you're trying to solve for. And that sort of informs the features you bring to the table. I do not think that this is a one size fits all kind of a situation where you can just create an out of a plug and play kind of solution. I think there's a lot of
Mhm.
evolution that'll happen as you go deeper and deeper and
Mhm.
solve some of these really complex problems, not just within one specialty, within subspecialties. Like even like if I think about neurology at Dent, there's doctors who focus on migraines, there's doctors who focus on dementia, and then there are providers who are looking at very, very different sub scenarios of neurology cases, and you need to evolve and customize for them.
Mhm.
So. I think that's a lot of heavy lifting that we had to do, and I think any
Yeah.
AI will have to continue doing if they have to create value in specialty. Do you agree?
Yeah. And I do agree. And I think that something I always say to the providers that new providers that are joining, I always say, AI, it's a learning curve, right? It's like
Yeah.
you can't just give up on it day one because, you got to give it a few weeks to like learn what you're looking for, just like they did when they were learning how to dictate, on a patient. So it's like there is a learning curve. The benefit will always outweigh the initial input of the time. And I think for me, it's like, even if it took me, a heavy lift in the beginning and we had to do kind of like the sales pitch and you were, doing a lot of the trainings and doing all the stuff, like all of that heavy lifting is worth it tenfold, in my opinion, to have 60 plus providers now in our practice, just like raving about the tool and the burnout reduction and all of that stuff. So I think that something to keep in mind when you're adopting a new technology in general, but AI especially, like the investment is worth it, both mentally, physically, financially, all of that stuff. So
Um, Amanda, another question I wanted to ask you was about the big elephant in the room, which is integration. I think no matter how cool a software is, if you're not integrated with the EHR that the group is on, there's no adoption that's possible. And it's a difficult topic, obviously, because it's not easy. Integration involves a lot of processes, a lot of moving steps to it. So I just wanted to understand from you, how was that experience for you integrating with your EHR a new AI solution?
sure. Um, I know I've referenced our pilot a lot, but I think obviously when you're adopting a new technology and you're not sure if you're going to make that full plunge into it, you don't want to do, a very expensive integration because, let's face it, they can be costly. And out of the gate, I think something that also made us attracted to the Marvix was like a lot of our providers were saying, just as it is, this is already making me more efficient. So literally like the ability to copy just a specific box and paste it right back into our EMR was still more efficient in reducing their brain fatigue as it was. And so that was also something that really was like, okay, this is the right route we're going. But with the integration, I mean, we've integrated so many technologies over our EMR, like to overlay them. And I have to say, like the Marvix integration was one of our most seamless, and any of the kinks that we had were on the EMR side, which is typical for us with the company that we have with that. But I think that you guys have really clear specs, and I think that that's really was very helpful. KJ, who's not on with us today, but he's really phenomenal. He really was able to articulate with our EMR team exactly what you guys needed, and it was probably one of the fastest integrations that we've ever had in the history of our in our company. So that was also really, really cool. And I think that you guys are really fast to respond to if like something wasn't writing back into our EMR and things like that. So, but overall, I think very painless, and I think it was worth the investment of the integration. But for those that are maybe not making that jump to integrate, I would say that the way that you guys are pre-integration is also still very cool. Like, I think providers could really benefit from it either way. But you do get the additional benefits in the integrated model of like viewing the previous progress notes and pushing it right into there. And so like there's definitely efficiencies that come and make the investment worth it for sure.
Cannot agree more. And I also feel for neurology, given that there's so much history sitting on the EHR, most of the visits are follow-up visits. Oftentimes felt the promise of ambient AI is actually so far from being delivered if you cannot stitch in historical data into the documentation that you're creating, because for follow-up visits, these are going to be really short visits, but the patient's history is somewhere sitting in silos in the EHR, and having the ability to integrate gave us finally the opportunity to actually create rich documentation for doctors that finally allowed them to not do a lot of post processing for follow up
Yeah.
visits, and that made it look like a rich clinical document. So
Hmm.
critical. One thing that, because you talked about the speed, I think one of the decisions that we took, which really worked out, was that not having a middleware when you're trying to do an integration helps. Like building your own integration in-house team definitely speeds up a lot of these processes, because a lot of these middleware uh, partners obviously have their own
Mhm.
timelines, and then EHR companies have their own timelines. So
Right.
typically these integration exercises become really long than what they were
Yeah.
intended to be. Yeah.
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 And I always, I take, not, I don't want to say I take it for granted, but we do have, someone on site. So it does make it easier. But I think, having a good relationship with whoever that is. So if it is a middle vendor, just knowing exactly how to articulate, like, what are the specs that you need from Marvix and to be able to talk back to whoever your point person is for your EMR is really important. I think the one thing we also didn't touch on is like E&M and the ICD-10
Oh, yes. Yeah.
tabs. And I think that that's something that we've found really impactful for our practice. I think when we get a lot of new grads that come out of, school, they really don't touch on, billing and coding in school. And we're also very fortunate to have a whole billing and coding team on site for us. And I know that's not the case for every practice that's out there. And so obviously our providers at the end of the day, they have the legal obligation to like pick their own ICD-10 codes and their billing code and make sure it's appropriate. But Marvix having those recommendation tabs to be able to give the rationale of like, this is why we think that should be this level. And then these are the ICD-10 codes that we're hearing the most in the note. That also really does help with that brain fatigue. So I think that you have some a really nice additional compliments just beyond the note. It's not
Yeah.
just no, there's so much. And I think that when we did integrate and we saw that visit summaries pull in, that allowed our providers to not have to pre or post chart as much. And that they were very, very excited about that. So it was worth it. All of that was worth it just to have the visit summaries pull in and have that help them. So
I guess that brings me to this question on your advice to your counterparts, clinical operators, who are evaluating AI right now for their organizations, but obviously are overwhelmed. This seems like a big decision. There's so many moving parts. What is that one piece of advice you would give them as they begin on evaluating AI solutions for their groups?
I think that I think having the relationships with the providers and really making sure like you're in there in the trenches with your team and really getting that feedback and making sure that it's not something that's just benefiting you administratively, right? You really do have to have that collaboration. And I'll kind of repeat myself on what I said before, but I do think making sure that you're reinforcing with the team that like it does take time and like the benefit in the end is worth the time and the investment. So both on the administrative side and the clinician side, I think that that's really important. Just keep reminding yourself as well as your providers as they're working with the tool.
Completely agree. And I think for me, one of the things that I have learned working with you, I have to say this, is how AI, if you're having any discussion on AI adoption, it's not a technical conversation. It's
Mhm.
an operational conversation. There
Mhm.
are a lot of moving parts to it. There are people involved. And to get any success in a large organization such as Dent, you gotta work from ground up.
Mhm.
You have to do the heavy lifting, you have to do the trainings, you have to be ready to customize at a provider level, at a user level, and have the ability to, I guess, evolve as the organization needs change. And that was
Yeah.
sort of like a PhD, I like to call it, doing a PhD in this domain. We kind of ended
Mhm.
up doing a PhD working with you guys and learning how it's definitely not a technology conversation that one has
Yeah.
when they're trying
Yeah.
to work with larger healthcare groups such as
Yeah.
that.
I think when you said it, I will go back to like our very initial like conversations with you guys, and I remember specifically saying like we and I pride myself in it. Like we hold our clinicians' hands, right? Like we really do. And so I think I said early on to you like the communication can go through me, right? Like, and it wasn't to be a barrier to my providers. I think they're all obviously phenomenal individuals and very intelligent, and they can do it. They're busy. They're in clinic. So to go back to the advice thing, if I could say, if you can designate a person that's going to champion your program administratively, that's doing all of the heavy lifting in the communication with the Marvix team, making sure that you're organizing those trainings, you're hand holding, like maybe you're working with the secretary to find a training time for that provider. If you're waiting on the provider to set up their own training times, if to, send over their notes for the AI to digest, all that stuff, like it's gonna take way longer and it's not gonna be as successful. So I think even now when I talk to providers, I'll say like if they're autonomous and they want to just click the chat button and communicate with the Marvix team and say like this is what I'm looking for, more power to them. That's great. And I think a lot of them are really comfortable now doing that, and they really see the success and like how responsive the Marvix team is for them. But I always say, like, I'm right here. If you just don't know how to articulate what you're looking for with the technology, or you want me to reach out because you've got to go see a patient, I think having a point person administratively is really, really important. And it doesn't have to be the director of clinic operations. It could be, someone more integrated in the like day-to-day managerially. Like it could be one
Yeah.
in each of your clinics. It doesn't have to be what my role is for this company, but I
Yeah.
think that's something important for success as well, is making sure you're helping the providers articulate and have they know who they can go to outside of the Marvix team for help.
So true.
Yeah.
Absolutely agree. Um, Amanda, any other parting thoughts? Any piece of advice? Any thoughts that you'd like to share?
I think, just we're in 2026, and I think that healthcare is just like I said, it's always evolving. Payers are continuing to make things difficult for everyone, and it's just a challenging industry to be in. And I think as payers use AI, and we have to kind of work through our own challenges and find different ways that we can kind of combat what's being put against us to make our efficiencies better. So I think being open-minded, I think adopting new technology, always looking and reevaluating your processes. I think every like once a year, just looking at that and seeing like how can we be more efficient. Healthcare is not the same today as it was, a year ago. And just constantly challenging yourself as an organization to move forward and help find efficiencies to reduce burnout for your team.
Completely agree. Thank you for such a grounded conversation and helping us look at this whole situation from an operational lens. I think a lot of people think that AI tools are these shiny objects and they're magical potions. And once
Well, they
you
are magical, Rashie. They're magical, but they're not magical potions. But yes, it's, yes, I agree.
there's a little bit of magic.
There's a little magic. But yeah, no,
Yeah.
thank you so much for having me. And I happy to be your first guest.
Yeah.
Thank you.
Thank you so much for taking out the time for this, Amanda. It was lovely having you, and thank you for this insightful conversation.